ASCO 2015, Thomas Baldrick for Oncology TV, joined now by Dr. Marc Peeters. He is from Antwerp University in Belgium. Thanks for coming all the way here just to do this.
Okay, thank you very much for the invitation.
Okay, let's talk about the final results of the ASPECCT trial. It is a randomized phase 3 non-inferiority of panitumumab versus cetuximab in chemorefractory wild-type KRAS exon 2 metastatic colorectal cancer. Give us, if you would, a background on this study.
Okay. So, as you know, in colorectal cancer, you have two monoclonal antibodies which are acting against the EGFR receptor. This is cetuximab and panitumumab. And until now, there was no evidence that there was a difference between both antibodies. And so this is the first time that we looked for a head-to-head comparison between cetuximab, which is a chimeric monoclonal antibody, and panitumumab, which is a fully human antibody. So what we focused on was, first of all, is there a difference in efficacy between both antibodies? And second, is there a difference in safety? So that is the aim of the study.
So what were the methods used in doing this?
So first of all, these are refractory patients of metastatic colorectal cancer. Second, they were tested for KRAS status, whether they were wild-type mutant. If they were mutant, they couldn't enter the study protocol. And then they were randomized in a blinded fashion between cetuximab and panitumumab.
What do you think are some of the most interesting results that you've got?
So the first point is that there is no difference in efficacy between both monoclonal antibodies. If you look to the toxicity profile, there are some differences between both antibodies. First of all, you see more infusion reaction with cetuximab, which is not a fully human monoclonal antibody. And second, what we have seen for panitumumab, there is a higher level of hypomagnesemia if you compare it with cetuximab. There was also the impression using panitumumab and cetuximab in normal practice that there is a difference in skin toxicity. But based on these study results, we didn't see any difference between both arms concerning skin toxicity.
What do you think the clinical implications are of what you've found?
I think the most important point is, first of all, that you can use both antibodies in this setting, that it's depending on patient convenience whether you use panitumumab or cetuximab, because the label of panitumumab is give it every 2 weeks without any pre-medication. Cetuximab, the label is every week with pre-medication. And then there is some difference in side effects, like I already mentioned, and that might influence your decision which antibody that you use in clinical practice.
Thank you for sharing your work, Dr. Peeters. We wish you safe travels home.
Thank you very much.
Good luck.